Welcome, welcome, my support fibromyalgia friends. It has been a little bit of time since I've done these lives, so I'm back at it again and with maybe a new title for you that I want to throw around and introduce. I'm calling it Foggy Fridays, or maybe it's Foggy Friday, because I definitely want to have some live chats despite some brain fog. Like today, I wanted to make sure, even today, I'm trying to make sure I stream on the right channel, so I had to double check that. But how is everyone doing? Just checking in with you. It's been a while. So leave a comment, let me know, leave an emoji, how it's going in your world. I am Melissa Talwar. I am the executive director of the Support Fibromyalgia Network, and I'm also a board certified functional medicine health coach. What is happening with January? So January rolled in pretty strong over here with a lot of illness, and it's just trying to maneuver through the times. And I want to hear from all of you to see how you are managing, how you got through the holidays. I know in my world, I tend to get more fatigued during the winter times, and there's been a lot of winter storms throughout the country as well. So how that affects you. And I want to actually learn from you as we move into our discussions here, because that's what Foggy Friday or Foggy Fridays is supposed to be about. And if you like that title, please definitely give us, shout outs there, or maybe other ideas, or now it doesn't pass. But I think with this brain fog, it's all about like random chats on Foggy Fridays here. So anything goes. I know I love more structured types of education, which I'll bring you shortly, I promise. We'll roll in out as the brain fog like kind of lifts. I think again with these winter changes, and it definitely is difficult to adjust, and being conscious of what's going on with fatigue aspects and what happens with the changes. But I need to learn from all of you out there because of all the barometric pressure changes in California aspects, because I'm based in California. I didn't necessarily have so much of it, but I'm noticing in the last couple of years, this actually might be happening. And I know a lot of you in the Midwest talk about it, and you can sense when the storm is coming in. And it was always intriguing. And there is scientific evidence, especially in other communities, that they notice these shifts and they notice how they feel. So if that does happen to you, definitely leave a comment. If you're watching the replay later, leave a comment. And let me know how you maneuver through it, and what does it take to try to figure this out, and what you noticed. Like, is it more of the winter, like snowstorms, or you notice it with rain? As I get into some of the complexities of what happened with current events, it's actually intriguing to me. And I'm still intrigued because I'm trying to figure out what exactly was going on recently, with what I was trying to figure out, especially with the pandemic going on. And you're like, is this COVID? Is this my fibro? Is this something else? So as that is something I'm trying to work through and understand at the moment, it'd be interesting to hear from you. But anybody chiming in too, it's just please share what's going on. And we're going to have an interesting talk on current events. Going to try to go low pro here. To all, I know I've been doing more stuff on YouTube, but hello to my Facebook friends who I haven't seen for a while. It's good to be back through the live streams here having this discussion. But there's more conversation again for immune compromise that's coming out, and that's what I wanted to talk about and make sure all of you are getting the information you need. It's complicated, and now you're seeing even different countries disagree about the approach of how to tackle current events. And the United States has a different approach with it. And there again, I was watching some of the ACR outputs of information and what they were giving immune compromised people, or, people with autoimmune underlying conditions. And so with fibromyalgia, I know that you have fibromyalgia, and it's still unclear of its impact when it comes to COVID. But if you have had COVID, I want to hear from you. And please be kind to each other in these discussions as we share, because I just have been disappointed with the information that's been given out. It's definitely, we need a full encompassing of information. So just would love to start more of a discussion, and I've been trying to figure out ways to do this. I think we started a Discord section. If you're on Discord, please let me know how it's going over there, because we want to maybe start we put together a fibromyalgia Discord section, and I got to get familiar with Discord, but I want open comprehensive, kind, and compassionate discussion so that we can get the information that we need, the valuable information that we need. That's kind of missing when it's skewed. And I like an overall perspective because I think I was still disappointed. Like, we're okay, so we understand they're bringing in more information for immune compromise on another booster, fourth booster. And then they're talking about prevention. So I think most of us are already familiar about prevention. And I saw isolation there. And I'm like, well, if you have been isolating, you've been isolating already. But the thing that's missing to me that is the treatments and understanding the treatments. And I've done previous videos before. You can go to things like YouTube channels like MedCram. They have really good information on understanding and breaking down the treatments without politicizing it. And you can learn about what's available. And then even like the Dr. Mike Hansen had information on treatments early on. And so I'm not sure if it's still applied, but I've been joining echo conversations on post-COVID, long COVID treatment of COVID across the country. And you're hearing from providers, and it's actually good information. And I think this needs to be shared with patients. I do feel that we're kind of in the dark, but there are providers actually getting and sharing information on treatment protocols, right? But here's the question I have for all of you out there right now. If you were to get sick with COVID, do you know what you were going to do? And I want to, this is a good opportunity for people who have already been infected to kind of share their experience because I'm concerned. And this happened, I think it was a false alarm over here, but the challenge of potentially getting sick, and this is just, I started to have symptoms of something. I woke up Wednesday morning really super fatigued with a headache, and I had a runny nose. The runny nose threw me off. And so I just started a protocol. I isolated from my family. I made sure, but then, you start working in. I'm like, I'm not prepared. I started doing nutraceuticals just right away, just trying to figure it out. And on Thursday, I got super, super fatigued where I couldn't even sit up. Again, there was some congestion in the nose. I did do an at-home test. I was fortunate enough to get these actually when they had. So I got the at-home tests. And again, I was fortunate to get those. They had in June, they had a BOGO sale on CVS because I think that's when people thought this was all over. So there was a buy one, get 50% off of another test back in June. So I just happened to get those. And so I ran the test, it was negative. And then I'm like, okay, well, I'm still having these symptoms. I don't know. I don't know how it's working. But again, you just isolated from my family. I have two immune compromised parents in the house. So I'm just isolating from people and not feeling great with the headaches and the fatigue were the worst part of it. A little bit of runny nose. So again, I just went to the protocols that I know for at-home treatment and trying to figure out no one else in the house had any other symptoms. And I think it's complicated for me because I was actually going through some chemical sensitivities before this. I was super fatigued. Yeah, there was a lot going on. People were getting sick in my network that I was trying to help. I've actually been doing a lot of health coaching over the holidays, and a lot of health coaching in January, especially with I do health coaching for long COVID groups, like a group health coaching, and we did lose a few people that were co-infected. So emotionally, I was emotionally drained, and then we had some chemical sensitivities. I've been managing that a neighbor's construction. It does stink right near the neighbor's house in a certain area of my garden. So I haven't been doing vegetable gardening. So I haven't been doing that. And then there was another apartment complex that tarred their roof, so smelling tar at that point. So that was going into the weekend right before. And then somehow on Tuesday when I went out, there's a smell of gasoline. So all of that, with that a chemical sensitivity tipping point to produce that fatigue output, or did I really, or was I getting COVID symptoms? And I did test a second time, and I was negative again, but these are the complexities. And a lot of people go get a PCR test. I live in Los Angeles County, and there were no free PCR tests available, no appointments. If I wanted to do a walk-up, I'm not eager to be standing in line, and I was already so fatigued I could barely stand up. So I'm like, and do I wanna put myself in a predicament where other people are guaranteed to be sick? And I'm just like, I'm not sure. The drive-throughs were very far away. I'm not gonna be driving myself in the condition I was, nor do I wanna expose my parents or anyone else if I do. So these are things that are running through my mind, and that's why I'm just talking with you all today to see what you guys are doing out there and if you're getting the resources, because it was really difficult to even consider doing a PCR test to confirm it, and I didn't do it. So and the cost too, if I wanted to get a one that I could get possibly appointment, I was like running $125 minimum. And then again, some of those results, like unless you paid a lot more money to get the results, like another extra $100, I wouldn't get the results till like 5 days later. So I'm curious to know if this is happening across the country in other parts. Are you getting the resources you need? I've heard some of the treatments are limited, but I definitely want to hear from all of you and just try to inform you. I know I've given you resources from the functional medicine area. So the Institute of Functional Medicine, I've shared resources. Again, go to MedCram. You can learn about monoclonal antibodies. You can learn about the treatments that are coming out for it. We do need to get better at treatments. That's one thing that I talk about. Even my family hears me talk about it a lot, like at home, right away, what we can do, because a lot of these medications have a window of time. And this is how it's been the incubation period of the virus. And then when it creates an inflammatory response, and we're still unclear who it chooses appropriately, but informing people about what to do. And that's my curious question for all of you. Like at home, what do you do to manage it? How do you feel? Is your doctor responding? I've heard stories of people where they get dismissed by their provider when it comes to this. So they get sick with COVID, they reach out to the provider, that they don't hear back, or the provider just gives them the answer, well, let me know if you end up in the hospital. That's not a treatment plan. That is not a treatment plan to take care of everything. So this is why I'm just asking you, because even from my own experience, just reflecting on the nervousness of what was possible. And fortunately, well, like I said, it's still unclear to me, but the odd part of it again is that I woke up Saturday morning. It rained. I woke up Saturday morning and it rained and I started to feel better. Like this stuff started to clear up. I'm still like fatigued but the headache just cleared up. So that's why I have to ask all of you out there with the changes of storms and weathers, which I had never really experienced as much before, but I'm starting to experience it more in the last 2 years. What is that all about? So is this like a signal? Like I have a weather antenna on my head that when the weather shifts or the changes in the air, like it just knocks you out. So that's something new to experience. And I know we kind of get dismissed from providers when we talk about it, but I hear all of you talking about these weather and seasonal changes and how it creates that fatigue in the body. And, I didn't get a chance to go do blood tests, because one of the things you try to figure out when you do get some form of fatigue is what's creating that fatigue. So, some of the things to consider is, iron levels, vitamin D, thyroid, reactivation. So, I do tend to get some reactivation of EBV, which tanks my thyroid. I've seen it in when I biohacked different levels. So, and in past history levels, which I didn't know, doctors never pointed out to me. Adrenals, you're looking at hormones, you're looking at those things. But this barometric pressure is very intriguing to me, which I didn't look like, or seasonal changes. I mean, with daylight savings times, it gets darker sooner. So trying to fix circadian rhythms a lot is fascinating, but there's so much to be done. And that's why having these open discussions out there is super important, and just bringing that to the table as we move forward. So just wanted to check in with everyone to see how you are surviving with January 2022. It feels again like someone mentioned false starts. Like last year was a whole year of false starts. Like, okay, we're gonna go, we're gonna do this. But I definitely know that we're doing the best that we can. But just trying to like maneuver through. So shout outs to anyone out there. I understand the confusion and trying to get the information, and what information is still missing. What information do you need? I know over here at Support Fibro, we do talk a lot about food insecurity, food access, nutrition, and those are things too, is to just get some preparation if you can with nutritious meals in the freezer, prepped and ready to go is something to consider because I've had heard, even if the feeling of not feeling well or as fatigued as I was, if you're by yourself and just trying to get food and nutrition and hydration into your system, having those things prepared in advance is important because it might even just be, it might be really hard to get out of bed, much less cook something and then go and just get it outside the door if people are delivering you food. So think about those things and what might happen if there's a sense of fatigue, or maybe you're already feeling fatigued. So these are challenges that we go through as a community, and just having things prepped in advance is super important. And speaking of that, I mean, if anyone needs the tests, are the government opened up the website. I was really surprised it actually didn't crash. You can order the 4 tests per household, so that is now available if you need it. Just have it on hand as a backup to avoid some of these lines that I saw on the television screen because, we're already fatigued. I don't think we want to be standing in lines to get tests or even sitting in our cars to get tests, and then we're exposing ourselves to a lot of people already with all the fatigue. So might be just beneficial to have those home tests. I heard something about them also sending masks. So if anyone has questions on that, definitely I've dug in 2020 to all the concept of masks. I hope that they have gotten rid of a lot of the fraud N95, but I think it still exists. So be careful if you are purchasing stuff on sites like Amazon or big box sites, if you're not buying something in the store that's, boxed as opposed to just buying randomly online. There are some actually really decent cloth masks that have the filtration system in there. You can see videos even like on Stark's mask, which is built by a vacuum company. And they're much more comfortable too if you need it. So just let me know, reach out. I've been doing a lot of this research since 2020 of figuring out, or if you need nutraceuticals as a backup. I mean, that's what I started with right away with the nasal sprays. I use Restore and Xclear just on a regular basis for allergies anyway. So as prepped, mouthwashes more frequently, all dialed in with the vitamin C, glutathione, NAC, which I naturally take glutathione anyway for just production of antioxidants, which is a whole nother video that we need to talk about, is just glutathione. If anyone's familiar and knows a better expert on glutathione, I definitely want to invite you on the show because it is an antioxidant and a supplement that is not talked about enough in fibromyalgia community. And there was a lot of research early on with not the lower production of endogenous glutathione, creating more inflammation in the lungs, which I'm glad brought to light more of what's going on now. But we definitely need more of that in the fibromyalgia community because you can be genetics, based on your genetics, which I have, you might be producing less glutathione. So supplementation, and it gets mentioned a little bit with NAC in the production. So the precursors, and I have my background here of all of the pathways that you can influence in your genetics in different ways. But these are aspects of nutraceuticals. So if anyone needs that documentation from the Institute of Functional Medicine with nutraceuticals to boost your immune system, definitely reach out because that's what I dialed in with, all the zinc, curcumin, all the anti-inflammatory, staying hydrated as much as I could, the teas, and any properties like that. Because I love getting teas in smaller dosages that have those nutraceuticals as I test work, because too much, right? You can't, in sometimes forms of capsules, you can't titrate it or reduce the dosages of some of the supplements. So I definitely like more tincture based things so I can adjust dosages, and then I can adjust with teas and test out stuff just because of sensitivities. So start the work and empower yourself because you have the means, right? So if you're getting dismissed by your provider, this is all about empowerment right now. I know it's tricky because we got brain fog. We've got a lot of stuff on our plate, but it's definitely something to look into and do some more research about. So it definitely just wanted to check in with everyone, just see how they were doing. I think that was all for the discussion today, but I wanted to open it up and just let people know we're back. Definitely have a lot of comments to catch up on. I appreciate people sharing their experience, especially right now. And I have a lot of comments to catch up on. And I want to learn from all of you because this shared experience is important, especially when information that's been given to us is lopsided. And I get it, I get the focus, but we have to help people like in the moment and make sure we reduce that stress to help you with the information. um just not politicized information so you can empower yourself to make the decision you need for your own health, and that's all around, right? Doesn't just in the fibromyalgia community too. And I encourage people to participate in the discussions, be kind in the discussions, no judgment, and open to compassion and sort of adjustments of figuring this out. We do want to do more research based information where you can share, and maybe that's the way to go if you don't feel as comfortable sharing in comments. But it's definitely work in progress. I am feeling better, so that's good news with whatever happened. I guess I may never know. I'm figuring I would know if there was something like that, but maybe it's just, yeah. Tell me what it's all about with the barometric pressure and the weather changes. So I'm definitely on it with the biohacking. I have my systems. We'll be exploring that more. I did invest in a vibration plate, so I've been slowly integrating that and learning. I learned about the vibration plate at Dr. Terry Walls's conference. So someone presented, and it was intriguing because I had stepped on a vibration plate before through like a bulletproof conference or biohacking conference. And I was like, whoa, my head got too much like vibration. So, but I found out there's other ways to do it, which I didn't know, because you just step on the plate and it was like way too much. But this I'm like starting by sitting and then slowly acclimating myself. And there's different levels that you can adjust. So I'm going to get into some of that more science. I've been using my Sauna Health. They've been great to let me try out the product. So I need to do a video about that. And if I'm diligent enough to actually do the device, I actually noticed it was helping my sleep, which if I don't do it, then I'm noticing, okay, I'm still having the rumination. So it's pretty cool. We want to make these things try to be more accessible, affordable, which right now it's tricky to maneuver. But if we can get some more science about it, maybe there's ways to have different coverage. We'll do some more conversations on health coaching coming up. I'll be doing a conversation on Dr. Wallace. I know I've been remiss at doing that with the Wallace protocol. And so that's coming up, more conversations on all kinds of nutrition aspects, because nutrition is important. But again, I want to take away the judgment, because I see a lot of people, it's like, I got to lose weight. They're with a doctor right now. You got to, I'm like, okay, no, we got to throw away the judgment, because it's very complicated for our systems. And being in chronic pain, be having fatigue, it gets even more complicated. But we are going to get into some aspects of nutrition. I'm going to explore and explain a lot of different things. Even when it comes to like keto. So being certified with New Keto Nutrition, but also being trained with Dr. Terry Walls and Apollo Health. I know like the Keto Flex for Apollo Health and the Bredesen protocol, which for brain health, Alzheimer's, dementia, and then Dr. Terry Walls has her version for the ketogenic. But I'm going to tell you, it's a therapeutic version for ketogenic diets. So that's what I'm trained in, therapeutic. It's not like I didn't train in like magically losing a lot of weight for keto. So this is about therapeutic, this is about health and improving your health with whatever you feel is more comfortable when it comes to understanding what nutrition can bring to your life. And for some people, you can see dramatic results right away. And other people, it might be fine tuning. And the hardest thing that we talk about too with health coaching is you can dial in your nutrition a lot. But if your sleep is out of whack, or you're not sleeping, you're not getting restorative sleep, that may be the funky little like rock, that may be the barrier in the way, honestly. And trying to get sleep, and I've had this discussion in health coaching sessions, it's complicated, especially when you feel like you've tried everything. And I get frustrated too. It's like, I'm trying everything, but getting that good quality sleep is just, it just seems like it's a myth. And experiencing that. So we're going to get into a lot of that. And I want people to share. I want people to be open-minded to new ideas as we share, and definitely just share your experience, because learning, and I get how frustrating it is, but it's all these components coming together, and we work together as a community to bring a better health to the fibromyalgia community, better health experiences. We are working on Echo. I gotta get that going. So if you have a provider, we need providers. And I know providers are slammed right now, but we need providers to come and join us. So please let your provider know. We're going to come up with some sort of flyer. So maybe that way, if you want to send them that flyer or send them or print it out, take it to the office, definitely those are things we want to give you and tools we want to give you, because we need these providers on board to democratize fibromyalgia information and education for providers to be able to have more experience on treating fibromyalgia. So that is to come. I will be getting back to messages if you want to share your experience, if you are managing or you did get sick with COVID or you're experiencing post-COVID, long COVID, please definitely send a private message. I will read them. I will go through the information. I'm very curious about how we can help people and the experience of it. Are you getting dismissed? Is it just, you're being told it's just fibromyalgia? Those are things that I want to hear from. So thank you everyone for tuning in to Foggy Fridays. I told you it's going to be random. So I'm just going to jump on here randomly. Hello to Catherine. Thank you so much for tuning in, and everyone else that was tuning in. I've taken up some time here. So this is good. So it's random chit chat. Please come with your questions, ask your questions. Maybe if you have a topic idea that we want to go through that you haven't heard yet, let me know, because there's so many topics to go through, right? So we just dial it in. I want to be able to talk about nutraceuticals in some ways. Like I said, I love glutathione and it changed my life. So being able to have a scientific discussion to share, maybe it's something that you can ask your provider about in the world of nutraceuticals and what we can bring to the fibromyalgia community, because it's not talked about enough. Vitamin D experience, what it is if you're low on vitamin D, looking for basic information, which I think gets really missed. And besides, I've been doing my clinical training with the Karazian Institute. I am blown away. I wish I could share this information, because he's actually been going through videos with us, patient videos. So we had a 206-page clinical review of a patient who has lupus and mixed connective tissue. And I am blown away by his exam. So we're watching videos on the physical exam. He goes through the blood test values, the case review studies of all his notes. And I was like, what? Like, is this really happening in this country where a provider is doing this comprehensive of a clinical review? And he's going through all the lab tests, and it even makes me think. I was like, I don't think I've ever had those lab tests run to really eliminate autoimmune conditions properly. Like, you get so far with like rheumatoid factor and ANA, and then I think it just falls off. And for some people, but if you have an autoimmune condition, but if you're in between, like, are you getting what you need when it comes to this? So I'm amazed. I'm definitely amazed by working with other clinics through the health coaching, that there are providers out there doing really lovely work. So I'm just, there's changes happening in the medical community, and we're going to bring it to the fibromyalgia community. All this networking, all the health coaching I'm doing, making connections with people, I'm seeing it around the country, meeting different providers and collaborating in a health coaching setting through my work has been valuable, because I love it. There's some amazing women solo entrepreneurs who have medical providers with their solo practices that are embracing health coaching, but they really care about their patients, and they go to the house to make sure their patients can log on to Zoom and so I'm in awe. And so I do know we cannot lose hope. It's out there, and we'll bring it to the fibromyalgia community. So that makes me excited. Thank you. I know we have some more people tuning in. So thank you so much. Stay tuned. Again, we want more structured education coming up. If you have topic ideas that you want to get covered as much as I possibly can within scope, or if you have someone that wants to do an interview on the show with maybe a relevant topic about fibromyalgia as a medical provider or something else, let me know. Thank you so much. I am Melissa Tovar. I am the executive director of the Support Fibromyalgia Network. I'm also a board certified functional medicine health coach. Please like and support our organization, and I will see you later. Bye.